Welcome to Atrium Health Levine Children's Hospital. I'm excited to welcome you to this tour. Along the way, you'll get to see our units, our departments, and meet some friendly faces. Levine Children's Hospital is home to the region's only nationally ranked children's hospital, and that gives you comfort to knowing that we can provide the very best care for your child and family. We have lots of amenities to make this your home away from home. You'll find the Ryan Seacrest Studios. Feel free to take advantage of some of our food options, our coffee shops, our gift shop, and even say hello to some pets along the way. We have a team here at Levine Children's Hospital waiting to help your child feel best about their care. We have child life specialists, music therapists, dance therapists, and everybody in between should be here to make sure you feel comfortable. As a mom myself, I pride myself in making sure that Levine Children's Hospital is a place that you can have the very best care right here in your backyard.
So when patients or families come to this floor, we have hearing testing, ultrasounds, x-rays, and MRIs. What makes the third floor really unique is that both radiology and audiology have outpatient testing on this floor, but we also go bedside to see families who are admitted. And this is really nice because we're able to meet families and patients where they're at. In the waiting room, it's also kind of an under-the-water sea beach theme. We've got video games, they've got tabletop games, the TV's going with pediatric-friendly shows, so there's plenty to do for the kiddos that are waiting to be called back for their appointment. I've always been really passionate about working with kids. I've wanted to work with kids since I was little. In this job, I get to work with children and their families, which is really fulfilling to me.
The majority of children that we see on this floor is our behavioral health patients and social hold patients, but we can also get medical kids as well. What makes 3K such a special unit is we have designated walk times for them, and then we also have our putt-putt area outside, which is where they're able to get some sun, and then we also host group. Group can consist of just therapeutic communication. Sometimes they get to make fun art or video games, and a lot of our kids have patient safety attendants, which is just a one-on-one person that gets to stay with them and interact with them throughout the day. I sometimes get sad when I see some of our kiddos that are here for longer periods of time and they finally leave, but you're so happy for them because you don't want them to be here forever, so you're so excited for them to be able to blossom their wings and go.
This is our rehab floor. We have kids that come in from in-house upstairs or outside facilities, and so they're seen by physical therapy, occupational therapy, and speech therapy. We have a couple different unique spaces, one of them being our Knights baseball themed playrooms, and then we also have a teen room, and then there's our traditional therapy gym that has state-of-the-art equipment. Our goal here is to meet our patients where they're at by using individualized exercise programs. I think it gives our families peace of mind, knowing that we really do care about their child, not just as a patient, but as a person.
Fifth floor of Levine Children's Hospital is unique because it serves as both an inpatient side for patients that are coming in for quick stays and procedures, as well as people that are being admitted unexpectedly as well. From the time you arrive on the fifth floor, if you're coming in for a procedure that day, the first stop you'll make is in our waiting room, and we have staff there who are dedicated to communicating with you throughout the process as well. They might get you enrolled in our EASE app so that you can get text directly from the operating room when the surgeons are starting the procedure, but they're there as a point person for you as well. One of the things I think that is unique is that children have private pre-op rooms, they have private recovery rooms. So we break down medical terminology into terms that make sense to them developmentally. We focus on individual fears on different developmental levels and know how to address concerns that they might have. Each of the people that choose to be here for a reason. You can tell that they have a love for children and a love for the work that they do, and that shows in all that they do.
LCH6, it's our critical care floor. We have our cardiac ICU, and we have a multidisciplinary pediatric intensive care unit. As a parent, one of the things that is wonderful about our unit is we embrace our families. We have a family lounge. We also have family sleep rooms, which is right outside of the unit so they can be physically close to their child, but still be able to get some rest. We have a warrior wall. It's t-shirts parents have sort of given us, and it's a constant reminder of why we're doing what we're doing every day.
The 7th floor consists of the level 4 NICU. We get the premature babies that need ICU care. We have a lot of support systems in the nurseries. We have therapies, we have social work, we have family navigators who help support and walk them through their journey. We have bedside cameras. Bedside cameras are for the parents that are not here and they can look at their baby when they're at home. The work on the 7th floor matters because we are there to support these families through the NICU journey, and just having support systems like we offer is huge for the families.
On these 3 floors, we see patients of all various medical needs, and we can really care for anything that your child is needing. When a child is admitted to the hospital with their parent or caregiver, their physician will be notified. Their nurse will take care of them as soon as they're admitted and really get some information and history. A child life specialist may greet them to really assess how they're coping with the admission and to get on their level and really just make them feel comfortable alongside of the family as well. There's a variety of spaces on the unit that are accessible to patients and families when they're here. So we have playrooms, laundry facilities, and a snack room at your convenience. We feel that every child is entitled to having a child life specialist on their care team, primarily because our background is helping children to cope with hospitalization, and it just makes me feel very prideful to work for Levine Children's and to have the role that I have, because I feel like it's important, and I feel that parents need that support and that children need that specialized care.
We see on the 11th floor of Levine Children's Hospital, we see primarily our cancer and blood patients. The nurses are incredibly dedicated, the physicians incredibly dedicated to making sure that we treat the children and their families like our family. Things that make the 11th floor unique here at Levine Children's Hospital is we have one room called an MIBG room, which is a very fancy room used for radiation therapy. We are one of only about 20-25 centers in the country that have that on this unit. We're very excited to also have a isolated cellular therapies program. It's an 8-bed unit that is enclosed completely with its own play space. These children lose their immune system completely for somewhere around 30 to 45 days. The fact that it's a contained unit and they're able to walk around and really feel like they're not locked in their room is very important. As the father of 2 boys, I think that our floor just exudes compassion and love and care for your patient.
We are the only level 1 pediatric trauma center in the region, which covers a very large area of North Carolina. We have prided ourselves on really providing family-centered care, meaning that at all times we have family at the bedside. We never ask family to leave. It's something that's very special because you won't always find that. As a mother, I understand firsthand how hard it is to wait with your child anywhere in a doctor's office or an emergency department. We have a lot of child-friendly things out there. There are games out there for kids to play. There's murals to show your kids. And we keep a clinician out there to make sure that if any child started feeling differently or if something happened or changed in their condition, we can get them back as soon as possible. Our work here at Levine Children's, to me, matters because we want to be the best care and the best place to come for children that need help in our community.
Thank you for putting trust in us at Atrium Health Levine Children's Hospital.
This is your community hospital, and my husband and I are so proud to be a part of a place that has world-class care for children and families. We hope you have enjoyed your tour.